The Islamic Medical Association of South Africa has released a public advisory, public health advisory on a COVID upsurge and, of course, the precautionary measures. To talk about it with us is the Vice President of the Islamic Medical Association of South Africa, Dr. A.K. Peer. Assalamu alaikum wa rahmatullahi wa barakatuhu, Dr. Peer.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
Welcome to the program, Dr. Peer.
Thank you very much. Thank you for having me on.
I see you've issued a warning, which was dated on the 22nd of December, and we find that there are, there's an upsurge in incidences of COVID cases in countries like Singapore and Malaysia. Um, can you give us a brief on that upsurge?
Yes, sure. Bismillah ar-Rahman ar-Rahim. So, the virus that causes COVID-19, we're familiar with that for the last 3.5 years, and the devastation it has caused is constantly changing over time. And as the virus changes, sometimes it gets some new properties which either allow it to spread more quickly or more effectively, or it also is able to evade the immune system that we've developed against the previous strains. So you have a new variant. So currently, there's a new variant that has emerged. It's called, just for those who are technical, it's called JN.1. Okay, so that's the new variant, and it's been sort of identified in the last maybe 6 to 8 weeks. And what's alarming about it is that it has spread very, very rapidly. So that's really the background to the alert that the IMA has sent out to say that there is a new variant and the COVID is now spreading rapidly, causing new infections. However, the good news is that it does not seem to be causing any more severe infections than previously. So that's reassuring. However, it is spreading very rapidly. And it's now the traveling season, especially for us in South Africa, and people are
Mhm.
moving all over the world. So this variant has been identified in now it's more than 20 or 30 countries. Started off in Spain and Malaysia and Singapore. So it's really moving out rapidly, and we thought we'd just send out a precaution to members who are traveling. We go to Saudi Arabia, for example. In Saudi Arabia
Mhm.
now, they're saying 37% of new COVID cases are due to this new variant. So that's
Mhm.
kind of the background to why we sent out this alert.
Right. And what are the precautionary measures? I think we all became very used to the generalized ones, but I think you've also specified certain ones for people who are traveling.
Yes, so really, we always say there's four kind of things that you should be focusing on to avoid getting infected. So prevention is the most important thing, and the one is, how do you avoid exposure to the virus? Okay, so there are a few things that we look at. We look at, for example, there's 4 Ds that I always think about. One is the dose of the virus. So if you get a high dose, if somebody is actively sick next to you, for example, on a plane and coughing, right?
Mm.
You're getting a good dose of the virus. Then it's the duration of the virus that you're exposed to. So, for example, sitting on an aeroplane, you find that the guy is next to you or in front of you is coughing all the time. You have a
Mm.
long period, maybe 6, 8 hours of exposure. Then you have the other thing is disinfection, right? So you can prevent getting the infection by disinfecting adequately, and then wearing a mask. So those are the kind of things that we need to do to get ourselves protected. So the 4 Ds, just to go back, is dose, the duration, the distance that you are from the person who is sick. Obviously, if you far away, you're not going to get the virus, and using disinfection. So those are the things that we can use to prevent the infection. And then obviously there's the issue of the vaccination, which is protective against severe disease. So those are really the precautions that one should take. And we know, as you see in the advisory that we sent out, that when we're traveling, there are places where multiple people are touching surfaces, airport
Right.
counters, etc. So it's wise to carry a sanitizer with you, a small sanitizer in your bag, and to carry a mask. And I was
Mm.
traveling recently, just a local flight from Durban to Johannesburg, and there was somebody behind me coughing incessantly from
Oh,
from the time we got onto the plane right till we got off. And obviously that person was ill, but coughing incessantly. That person didn't have a mask.
oh dear.
Fortunately,
Mm.
I carry a mask with me, and I put my mask on for the duration of the flight. So those kind of things we can do to protect ourselves. Because remember, there's no mandatory masking anymore.
Right,
That's required. However, like Singapore, for example, has reintroduced masking mandatory in indoor places. So
right,
again, the places where you are most likely to get exposed, as I said, is indoors where there's poor ventilation. So that's the other area where you can look at is find areas where ventilation is good. So people traveling to for Umrah, for example, at the moment, in the Haramain, there's little chance of getting infection because the open spaces and it's well ventilated. However, if you're in a closed area, having dinner or eating somewhere in a restaurant, and you stay there for a while, and somebody's coughing there, then the risk increases. So those are the
right.
precautions. Yeah. Gee.
All right. And the other thing you've highlighted here is to consider better travel insurance and also to have contact details of high risk patients. This is
Yes, because
specifically for people traveling, of course. Yeah.
yes, for people traveling. And again, it's just to highlight that, there is an increased risk that you'll get ill and then you require hospitalization. And then if you don't have adequate hospital cover, you may end up with financial costs which you may not be able to bear. So I think that's the reason why you need to make sure that you have a good medical cover when you're traveling. For example, in India at the moment, in the last week or two, there has been an increase in COVID as well, and it's spreading rapidly there. So people who are going, for example, to India, wherever you're traveling to, you'll find that there is an upsurge. And we know how COVID-19 spread when it first started. Slowly, it started in China and then spread across the world very, very quickly. So this
Mm,
virus, we still don't know which other, many countries haven't reported it, but you can be sure that it is spreading in many countries in the world. So just to be
mm,
cautious, make sure that you're adequately covered medically from an insurance point of view, and then to know, especially if you're traveling with elderly people, if they have some what they call comorbidities. So if they have a heart condition or renal problems, they're at increased risk of having adverse outcomes. So if they get ill and they contract COVID, even though this strain is not a very severe strain, you can still, especially if you're very old and you have a comorbidity, then you are likely to get complications and require hospitalization. And if you're in a foreign environment, you can
mm,
understand that cost of medical care is very, very expensive. So make sure
mm.
you have cover.
All right. We thank the Islamic Medical Association of South Africa for taking the time to put out this advisory, and we'll continue to follow it. Let's hope it is curbed very quickly. Of course, it depends on the precautionary measures that you've mentioned. I think we should just do that at home as well, even if you're not traveling, when you
Ye-
are in enclosed places and confined spaces, crowded
Yes,
spaces.
yeah, absolutely. And the other point I just want to make is that if you become sick, if an individual becomes sick, then it's an onus upon us to stop the infection from spreading to other people. So we need to have, wear a mask if you're at home and if you're sick to prevent other people from getting the illness. Avoid going out. You don't have to unless it's absolutely essential. Have a proper etiquette for coughing and sneezing. So those kind of things. So there's two issues. One is you can get infected, and one is you can pass on the infection. And we need to focus on both. So if you do get sick, then make sure that you don't harm anybody else by exposing them to your infection. So yeah, thank you.
Thank you. Thank you very much, Jazakallah. Have a wonderful long weekend
Thank you.
and all the best for 2024.
Jazakallah. Shukran. Thank you. Assalamu alaikum.
Walaikum salam wa rahmatullah. And that just about wraps up our program for today. We last spoke to the Vice President of the Islamic Medical Association of South Africa, Dr. Abdool Kader Peer. We've had a lovely program this morning filled with lots of information, news and views. Back with you next week, Wednesday, at the same time between 8 and 10 with my behind the scenes fantastic team, of course, doing the hard work. I'll be with you next Wednesday. I look forward to it. Have a fantastic long weekend. Stay safe, stay healthy, and of course, all the best for 2024. Assalamu alaikum rahmatullahi wa barakatuh. I'm Najma Khota for Salam Media's News and Views.